Good afternoon and welcome to Onslow Memorial Hospital's Facebook Live event on Colorectal Cancer Awareness Month. Here we have Dr. Stephen Spencer, our Chief Medical Officer, and Jennifer Provost, the Director of Onslow Radiation Oncology. And they are going to discuss some events happening this month and some ways that you can get screened for colorectal cancer.
Thank you, Sophia. So this is, of course, a very important month, and I think we do a lot of work, especially in preventative care, with cancer screening. Certainly we know about mammograms and the like, but colorectal cancer screening is really, really unique. And the unique part about it is that the actual screening is also potentially life-saving. So the colonoscopy is what people usually think about when they talk about colorectal screening. And then actually in the colonoscopy, not only is it diagnostic and you're looking for potential polyps, and of course if you have an actual cancer, but you're also looking to remove those polyps so they don't become cancerous later. So it is a life-saving treatment and diagnostic screening mechanism. But the other piece of this too is that there are other screening mechanisms that you can use, and depending on your risk factors, you may choose one of those other screening mechanisms. The other thing that we are realizing over the past few years is that the incidence of colon cancer is increasing in younger people. We first noticed this in African Americans, and actually the guidelines for African Americans changed a few years ago, where the screening was supposed to take place at 45. This has now become the age for screening for all folks at general risk of colon cancer. That age will also change, of course, if you have family history, especially if you have certain disease states that are prevalent in your family. But certainly everyone should be screened for colon cancer at the age of 45, which are the new recommendations. So Jennifer is going to talk to us about some of those options for screening and some of the great things that are going on at ORA.
Yes, so right now we have a screening event lined up to where patients can go and pick up a kit from Onslow Diagnostics, and there's some instructions in the little kit, and you're able to take it home, do it at your leisure, and then bring it back within 72 hours to Onslow Diagnostics, and then they process it and we follow up with a phone call with the results.
Wonderful. And tell me a little bit more about the program and how people can find out more about what happens there.
Sure. So we have some information listed on our websites, Onslow Radiation Oncology's Facebook page and Onslow Memorial Hospital's Facebook page, in regards to where Onslow Diagnostics is and the information about the screening event.
Perfect. And tell me a little bit about so I mentioned the colonoscopy. What's the difference between the colonoscopy and the screening that you guys are doing?
So ours is a little bit more open-ended, I guess you could say. Basically what we're detecting is blood in the stool, and there can be multiple causes for blood in the stool. It's really just that first line defense, a real easy screening that patients can get done, and then if we determine that there's blood in the stool, then it will necessitate possibly a colonoscopy or at least a visit with the primary care provider.
Gotcha. So it acts, again, as an initial screening tool, but if you do have a positive test, you'll go for the colonoscopy.
That's right.
That's right.
Yeah.
And tell me about radiation oncology. What is that, and how do you guys intersect with colorectal treatments?
Sure. So in radiation oncology, we actually use radiation. It is pinpointed at the specific body part that we're treating. Specifically with colon cancer, radiation is not typically used unless it's invading the skin surface or it's fixed to the abdominal cavity. However, in rectal cancer cases, radiation can be used either concurrent or sequentially with chemo. But it is a tri-modality treatment where we use surgical oncology, medical oncology, and radiation oncology.
Wonderful. And where are you guys located?
So we are at 317 Western Boulevard. We have the exact same address as the hospital. We are physically connected into the hospital.
And I heard about this guy, Dr. Ross, who's pretty good.
He's fantastic.
Okay.
Yes.
Good.
Yes.
So Dr. Ross has been around for about a year.
Yes, he has been here a year with us. We just celebrated a year, March 1st. We had a little mini celebration, decorated his office. And he has been an employee provider since September, so we're really excited to have him. Very lucky.
Wonderful. And tell me about what's going on in the future with ORO, both for specifically for colorectal cancer treatment, but also in general. What are you guys working on?
So we're really excited. We're going to be getting a new True Beam linear accelerator in the near future. So there will be more to come on that. But we're really excited about being able to offer all different types of treatment options to our patients. And we actually have an event scheduled this weekend. We're excited and honored to be partnering with Goodyear All-American Speedway, the Carolina Mini Stock Series, and the He2 Strong family. The race is going to be celebrating a fellow racer, Ronnie He2, who lost his battle with kidney cancer last year. And that's significant because he lost his battle in March of last year, and March is also Kidney Cancer Awareness Month. So we thought, what better time to have a race than the month of March?
It's a great thing. So I will be there. Very excited. Our COVID numbers are coming down. We're outside. It's going to be great weather. So if you're certainly able to join us there, that would be great. Any other final words that you wanted to say, Jennifer?
Nope. Just if everybody would like to join the race, it is again at Goodyear All-American Speedway, and I think the grandstand's open at 12. There's qualifying at 1:30, and green flag starts at 3.
Good. I'm excited. I've never been to a race, so I'm excited.
Yes.
All right. Thank you.
Thanks.
All right. Thank you for joining us. We hope to see you again soon, and have a great afternoon.